he was living with these aneurysms, like Isaiah, but not with blood thinners. It wasn't till the autopsy that they came back and said he had died from Kawasaki disease. And for Elizabeth, that was the first time she had also heard those words.
Hi everyone, welcome back to this week's episode on Take a Pain Check. I'm so excited to have Karen joining me today. Hi Karen, can you give me a brief introduction about yourself? Tell me a little bit about your education, your hobbies, your career, and what you've been up to recently.
Hi, everyone. So my name is Karen Lynn, and I am a co-founder at Kawasaki Disease Canada. So we were a not-for-profit that was founded in 2014, and then we became a registered charity, Canadian charity, in 2015. Um, and I'm head of their support committee. And on top of that, I also run a Facebook group for parents who have children with Kawasaki disease with coronary aneurysms. That's something I started in 2013, and right now we have over 2,000 members. We started with four, so that's a huge accomplishment that I'm really proud of. And I'm a full-time mom, but I spend a lot of my time working with Kawasaki Disease Canada.
Career-wise, is there anything that you did prior to joining Kawasaki Disease Canada?
Yeah, once upon a time, I worked in advertising in what at the time was called new media, but now you guys just know it as the online space. So that was many, many years ago before I had my kids. I used to do help companies plan their web strategy. Yeah.
I guess your story kind of and career changed based off of your own family story, your son's story, which we'll get into. So tell me a
Right.
little bit about your son. I know that's very broad, but is there anything that anyone should know?
So my son Isaiah was diagnosed with Kawasaki disease in 2011. So it was a few weeks, I should say, right before he turned 3. He was diagnosed with Kawasaki disease, and then it wasn't until about 6 weeks later we had our follow-up that we found out that he had long-term damage due to his diagnosis.
Wow, at 3 years old. And as a parent, how did you, like, what was going on in your mind when you figured out that he was diagnosed with this, like, life-changing disease?
It was scary. It was devastating, and we were just taken by surprise because we didn't expect that. We really expected to go in there at his follow-up and find out that, everything is fine, you're fully discharged, you can go home and just live your life. So for us to get this diagnosis, we were in shock, to be honest with you, because it was not what we expected. And they kind of had people coming in right away. Don't leave the hospital. We need to speak to you. And then they had a nurse come in and said, you need to start giving him injections starting today. There's a nurse that's going to come to the house and teach you how to do it. It was shocking and it was frightening. And it was one of the most challenging days of our lives because we did not expect this at all. Definitely caught by surprise.
Can you tell me a little bit more about Kawasaki disease, or for the viewers listening, how did it present itself in your son specifically, and just maybe some general knowledge that you know about it after working with the organization and I guess learning from your doctors?
Yeah, so I can tell you Isaiah's story, how we came to our diagnosis, which will allude to some of the symptoms, and then after I'll talk about all the symptoms, so it's more clear. So for Isaiah, he had started daycare. I think it was a Wednesday, and then of course, or Tuesday, and the next day, of course, he starts to come down with what we thought was just a bug, right? So fever, diarrhea, just not well. But it persisted, and we were giving him Tylenol, and the fever would just keep coming back till the weekend came, and we were like, he won't move his neck; it's very stiff. So we thought maybe it's meningitis, which is something that I think a lot of Canadians are familiar with. If you have stiff neck, you got to get checked for meningitis. It's very serious. Um, so we took him to the walk. I took him to the walk-in clinic, and the doctor looked at him and said, "Oh, it's a bit swollen, but it's probably just, a virus, and that's just part of the inflammation from the virus, right? Not a big deal." But then and later that night, he had developed a rash on his chest and his groin. So I took him to walk in the next day, and the pediatrician looked at him and was like, "Oh, maybe it's strep throat. Let me take a swab." he looks a little dehydrated. So she looked at his tongue and but it's just like, oh, he looks a little dehydrated. Let me take a swab. It will send it to your pediatrician. You'll get the results the next day. But at this point, Isaiah was really not himself. He was really tired. He was barely staying awake. He was still in a high chair at the time and could barely eat, was really drinking. He was just drinking Pedialyte all the time, which, he wasn't really eating. And I remember that night, though, before we took him to the walk-in on the Sunday, my husband said to me, "Are you sure you're okay? Do you want to take him to the emergency? Let's take him to sick kids." And I was like, I don't know. Maybe it's just a let's just wait it out. Because as anyone that's been in the ER, you're going to be there for hours and you could just come out with the same diagnosis. It's just a virus, go home. So like, we're not going to do that. But we kind of knew something was off. So we took him to his pediatrician the next day. And he looked at him, the same thing, said, oh, maybe it's, the rash is from just his reaction to this virus, right? Which apparently happens. I'd never heard this as a parent, and Isaiah's my second child, but I was like, okay, so try Benadryl. So we gave him Benadryl, nothing, right? He was still, he still had a bit of the rash. It went away a little bit, but he was just lipless, not himself. Didn't want to walk. Like when you told him to walk, and he's almost 3, so obviously he's been walking a while, just kind of hobbling, very unsure of himself. And we're like, this is not right. So we took him back. And then this was a Wednesday, so almost a week now. And our pediatrician was like, okay, I'm going to try to call the allergist. Allergist couldn't take him. Okay, your other choice is to take him to the ER and see what's going on. So we took him down to sick kids. We live north of Toronto, but my pediatrician was like, listen, if it's something else, they're going to have everything they need at their disposal to help him. So it's your choice. If you want to take him to your local hospital or take to sick kids. So we went to sick kids. And when we went to the ER, we waited, of course, hours. We finally got in there. And then, poke prodded him, looked at everything, looked at his feet and the soles of his feet. And we're like, I don't know what they're doing. And they came back and told us he has Kawasaki disease, which I had never heard of. My husband was with me. Neither of us had never heard of this. So, of course, you Google it because 2011, internet was there, not as vast as it is now, but there was some information. And it was just very scary. They're like, you need to be treated within this number of days. And if not, you could have long-term damage. But most kids go on to, live a normal life. So it was just like, okay, we need to make sure they treat him. And so it was all kind of a race against time at that point. And he did get treated. So I don't know if you want me to go back and I'll talk about the symptoms more clearly before I kind of go on with his story. So Kawasaki disease is typically diagnosed for children who have 5 days of fever at minimum. And then what the doctor's looking for are 4 out of 5 symptoms. So they're looking for a rash, which is normally on the trunk or the extremities and the groin. They're looking for red eyes. So not with pus or anything, like just red in the whites of their eyes, swollen hands and feet, and usually red here and then the red on the bottom of their feet, which is something they were looking for in Isaiah, but we didn't know to look for that. Strawberry, what they call strawberry tongue. So it's a red tongue and it's got the bumps, it looks like a strawberry, and then red cracked lips, and then a swollen lymph node in the neck. So doctors are looking for 4 or 5 of those, 4 out of 5 to get what they call a typical, a complete diagnosis. But some kids, the difficulty with Kawasaki disease is that not all kids show with all these. Like in Isaiah's case, he had the rash, he had the swollen lymph node, which I thought was a stiff neck. I didn't actually see it was swollen. Maybe he had the strawberry tongue, but the walk-in doctors didn't seem to notice it, right? And I didn't notice that his hands were red. Maybe they were. I didn't notice it. So yeah. There's a lot of that's a problem, and also because they don't always happen at the same time. So you might come to the doctor and only have one, but maybe your child had 2 other ones 2 days before. But if you don't write it down, you're not going to know to mention or think to mention it. So it's a tough diagnosis also because Kawasaki disease doesn't have a test. It's not you can take a blood test and they're like, oh yeah, or like a swab for strep and it comes back, oh yeah, positive, it's Kawasaki disease. They don't have that. They do what they call differential diagnosis, which may be something you're familiar with. I don't know in the juvenile arthritis world if it's similar, where they kind of look at what it can't be. Oh, it's not measles, it's not scarlet fever, it's not this, and they kind of come to this diagnosis that, okay, it's Kawasaki disease. There's certain blood they can take and certain markers they can look for that will point to it. Like it's a clue, but it could be anything because it's just inflammatory markers, which you get inflammation in a lot of diseases,
Yeah.
right? So they can use it as clues, but to actually get a diagnosis, they don't have something that says, yes, it is, or no, it isn't. So I think that's a lot of struggle with the diagnosis. And the reason why we try to raise awareness so much in our charity is because we kind of want to give parents that arm them with that knowledge that if they know this and they go in there, they can at least raise it and say, I heard about this thing, Kawasaki disease. Could it be that? And it couldn't, may not be. And the doctor might say, I don't think so, but at least you got them thinking about it early on, because early diagnosis is really the important thing in this disease.
When it comes to juvenile arthritis, like for me at least, all I needed to really get was an x-ray and a blood test. And then I knew my wrists, my fingers, my ankles, and my feet were swollen and in pain. So then my family doctor was like, okay, maybe we should do a blood test. And then when you look at the rheumatoid factor, the anti-CCP, the ESR, like there's certain factors that you can look at, and my numbers were really elevated. So then he was like, okay, do an x-ray, and then he saw damage, and then he's like, okay, I'll refer you to Sick Kids Rheumatology. So it was, in that sense, my diagnosis journey was 1 month, maybe even less than a month, a couple weeks. I kind of went to the doctor and then that's what it was. But I think my parents too, they didn't know what swollen fingers meant and that could be a disease. Like they thought it was a sprain. So they kept wrapping it up. So it's like, it's really tricky. And that's why I do believe like what you said of raising awareness is so important, because the more that other people know about it, they'll be able to look at different signs and symptoms and potentially be able to prevent it and go to the doctor quicker the more we raise awareness about it.
Absolutely. And something you said actually sparked, because you said your doctor, did the x-rays, did the blood test. And I think a lot of it also depends on who you get as your primary care provider. Because some doctors, I mean, there's stories that I hear because I run the support committee of doctors that won't want to take the blood. And I get that. You don't want to poke your child unnecessarily. And I know there's unfortunately a lot of over testing sometimes that's done. But there's some instances where it's necessary. And for a doctor to recognize that and say, okay, let's do the blood test just to rule this out, or to, point us in the right direction is important. But I think it depends on the doctor a lot of the time. So, because the same things, like you talk about ESR. So ESR, CRP, same things they're looking for in Kawasaki disease as a clue. So I think that's an important point, that it's having that knowledge, because if your doctor is not as willing, it's arming you with the opportunity to ask that and maybe get them to think about or consider at least any additional tests they can do.
For sure. No, I totally agree with that. I've also heard lots of people on this podcast kind of talk about how their primary care physician was not the most supportive or not the most willing to explore that. And so they had to like see another one. And after you see so many, your disease and symptoms progress. And so just trying to find the right doctor as soon as possible, be able to understand what the condition is. I think it's so important for us to provide those resources to people who may not even know that things like this could happen. And so I'm really glad that you have created this community of people having a child with a diagnosis. Your life changes and your child's life changes and your whole family life changes. So I'm wondering what the challenges were for you and Isaiah during the diagnosis process.
In terms of the initial diagnosis of Kawasaki disease, I shared that. So it was more challenging from the fact that it was just frustrating because we kept going back, and weren't really getting anywhere. And, in retrospect, looking back, it's a bit infuriating, because to me, these doctors, and I don't like to say it because I know doctors work hard, and it's just, from my personal standpoint, it was just frustrating because you would hope that one of them would have sparked just a light bulb, but maybe would have gone off that maybe this is Kawasaki disease, when I talked about their unrelenting fever, which is a huge signature of Kawasaki disease. So that there was frustration there after the fact. Going through it, I wasn't really frustrated because I assumed they were doing all they could do, and which I'm sure they were. And it's frustrating to think that that maybe doctors just need to be reminded a bit so that for the next patient, it's more top of mind. But in terms of getting a diagnosis of his long-term, that was not that, because they followed the protocol that after 6 weeks you go back for a second echo, because when he's released from the hospital, He had some dilation in his coronary arteries, but they were like, it'll just resolve more than likely. So when you go back, in that 6 weeks is when these aneurysms can continue to develop. So when we went back, it was a standard protocol, and we got, unfortunately, the bad news that he had the coronary aneurysm. So getting a diagnosis for the aneurysms was not frustrating because it was they were following what they should be doing. Um, but of course, it was devastating for us. Like I said earlier, it was just, I mean, getting Kawasaki's in the first place was unexpected because we never heard of it. And then to get this second diagnosis that we didn't expect was just, it just broke our hearts because we didn't know what this meant for him. Like, what does this mean for his future? What does this mean for, his lifestyle? What does this mean for him as he gets older? He was 3 years old at the time. And it was very scary because the reason why they need to put him on blood thinners right away is because he has these coronary aneurysms. They're basically, an aneurysm is like a ballooning of the vessel. And we're talking about the artery that supplies blood to the heart as a heart muscle to let it contract and do what it needs to do to keep you alive. So they give him blood thinners to make sure that when it goes in and it rolls around, it doesn't form a clot, which would cause a heart attack, right? Which means your heart can't pump anymore. So it's frightening. It was scary. He was young, so he didn't really understand what was going on. But for my husband and myself, it was really scary. And in terms of we didn't want to scare him, but he had to change his whole life. I mean, at the time he was getting enoxaparin is the name of it, but it's low molecular weight heparin. And it was by injection. So for years we were injecting him. So that's the thing that changed for him immediately as a 3-year-old. Suddenly he needs to get these injections and he needs to take these medicines. But so for us that was scary too. I mean, if you've never had a child, like if you're not in the medical field or if your child's has diabetes or something like that, to hold your child and inject them is can be very traumatic. You got used to it. But it was a huge change for us. It was very scary. Again, but in terms of support, I went online and I found some groups, some message boards that had some other parents that had gone through it. And that was a huge, huge support to me because you feel so alone because in this Kawasaki disease, it's like I said, a lot of parents haven't heard of it. So you're out there and you're like, how do you even find someone else that has been through this thing that you're going through, right? So I went online, there were some message boards, and there was a mom that I met who was also a sick kid's mom. So luckily local. So I got lucky and it was really helpful to kind of have someone just to listen. It wasn't like, okay, you need to do this, this, and this. It was more just to say, I understand and I understand you're scared. And that's a huge thing of why I started the group that I started on Facebook, and also why I'm so proud of the work that I do as a support committee, because I think that's so hard for parents, right? You feel alone because you won't just walk down the street and find someone else who's gone through this, right? So that was a huge part for me as a parent getting support, was just find other parents. But for Isaiah at the time, I mean, he's 15 now, and I don't think he remembers life before this, to be honest. Like, this is his life. This is the life he's lived, and this is the life he knows. And I'm grateful for that, though, because there's kids that are older who had to change things, had to give up things, had to stop playing hockey because they were diagnosed at an older age, and which is really hard. I think Isaiah doesn't feel that so much, I hope, because he didn't really remember life before.
Yeah. I've heard a lot of like for me, I was diagnosed when I was 13, so like I knew life without the diagnosis, and I think it was so challenging to now be like I can't really handwrite. I can't really like I couldn't play piano anymore. I couldn't play tennis anymore. Like there's just so many things that I had to say like I can't do this anymore. So it was hard because for the longest time I'm like, how am I gonna do school when all I knew was to be able to do school with handwriting, drawing, like all these things, and now I can't do it. And so still to this day, I am struggling to find ways to study better, to learn better, because for all my life, that's how I learned. And then it was like, now it's taken away from you. What do you do? And so for me, it was hard, but I've met so many people that do not know life any other way. Like this is what they've been brought up with. Those are the skills they've had. I think in both cases, pros and cons. I don't think anyone wants any of these diseases in general. But I do see the difference between like someone who has been diagnosed for all their life, who may be equipped with all the skills since they were younger, whereas someone who had to transition, it's still tricky and I'm still trying to navigate it.
Yeah, and that's tough. I mean, for you, like I guess the one good thing is you talk about resiliency, right? Like
Yeah.
building because you had to find new ways to do those things and to cope with it, and you're still doing that. So I think that that's a huge thing that I have to give kudos to kids like you and well, you're not a kid more, but I still call you kid, and my son and all the other kids because it's it's really unfortunate that you're living with these lifelong diseases, but you at least you have that chance to build that strength and maybe some other people don't have that opportunity. So it's kind of like you said, like pros and cons, but I think it's really admirable, to be able to do that and kind of pick yourself up and say, I can do this. And I mean, that being said though, and also finding support when you need it, because it's I think a lot of kids feel like, oh, I have to just do this on my own. And I think it's also really brave to say, no, I can't do this on my own. And I need to find those other people to support me, right? I
Yeah.
think that's just as brave, right? That's not a weakness. I think that's a strength to recognize that.
With the diagnosis comes medications that you have to take. So I'm wondering what Isaiah's like treatment journey was like since 3 years old to currently now.
So I'll talk a bit just quickly about the treatment in hospital because I think that's different than his treatment now. So in hospital, the first line treatment for Kawasaki disease is something called IVIG, so intravenous immunoglobulin. So that's from plasma. So people that donate blood, it takes thousands of donors to make this IVIG. And that is something that they give and is kind of to help reduce some of the inflammation that's going on in their body. And but then second line, if that doesn't, so in Isaiah's case, he got that, but his fever came back. So they gave it to him again, and his fever came back. So then they gave him steroids intravenously, and his fever came back. Then they gave him oral steroids. So he had a few rounds of treatment. And I think this is one of the reasons that he ended up with coronary aneurysms, because typically you want to get inflammation under control as soon as possible. And that's why I talk about early diagnosis, because the earlier these kids are treated, the earlier you get the inflammation down and you can hopefully prevent the damage to their arteries. Um, so that's why the early diagnosis is super important. And then, for some kids though, even past that, if the steroids don't work, there's other things they have to go to. Things I'm not familiar with, like I know the names of them, but like things like infliximab and anakinra, which I think are used in the rheumatology world. I don't know so much in juvenile arthritis, but I know are used for other types of inflammation as well. So sometimes kids will go to those things if those other lines of treatment don't work. Isaiah's case, they finally got under control. And so he was finally discharged. And when you're discharged, they just put you on aspirin. Oh, sorry, they also give you high dose aspirin in the hospital as well. And then you get discharged on it in case, so it's antiplatelet. So it kind of makes your blood cells less sticky, as they like to call it. And so that's just because if you are maybe developing these coronary aneurysms, you will prevent the clot. But when we got the diagnosis, as I mentioned earlier, he had to go on multiple things. So anticoagulant, which reduces clots forming, and an antiplatelet to reduce the stickiness. So he had two things. So he had injections, plus he was taking aspirin. At one point, he was actually triple anticoagulated. He was taking two antiplatelets and an anticoagulant. And the danger with those things is that there's the flip side of it. You want him anticoagulated, but then everything, like if he gets, that's why I talk about kids not being able to play hockey, because if you get an internal injury or a head injury, those kids will continue to bleed. You won't be able to get their bleeding under control. So that's why those things are kind of not recommended by the cardiologist. So that's a danger. And he was 3, so you worry about falls or just bumps to the head, like, because those are things 3-year-olds do, right? Like they like to climb, they like to run, like, and they're still gaining their coordination. So it was it is scary to think about those things because then you have the flip side, right? Like you're worried about the heart attack, but then you're worried about the internal bleeding, but you have to balance it, right? So those are the things he was on. And later on, he got put on, well, it's a blood pressure med, but really it's just to help his heart because Isaiah, we later on found out he had a silent heart attack at some point, despite all these meds he was on. So he has some damage to his heart muscle. So he had to go on things to help his heart not have to work as hard. So he's on a blood pressure med and he's on a beta blocker. And he's also on a statin. So that's something anyone in the older population will understand. Like, a statin is thing that all the older people take to manage their cholesterol. But in Isaiah's case, it's found that there's these pleiotropic effects. So things that just help the arteries kind of heal a little bit or keep the inflammation down so they don't get worse. So he takes that. So, I mean, I do joke about it because I always say if you don't laugh, you're gonna cry. But I used to always joke that he is like an old man medicine thing because he's got all the like days of the week with all the things in it. But that's how you keep it organized, right? So those are the things he's currently on. But we finally at least got rid of the injections. He did that for years and years, but he's switched to a different med now, which is newer and not as used as often in patients, Kawasaki's patients. But it was the right choice. We made the choice with our hematology team, our cardiology team. We talked about it. We looked at the studies, and we're like, you know what, this is the right next step for him. Because sometimes you have to do that. Like you have to trust the doctors that they are making the right choice for him, even though maybe not all the data is there. But in terms of lifestyle, this was the right next step for him because, we don't want him to have to be out and injecting himself when he's with his friends because he's older now, right? Teenagers, you're not going to expect him to be doing that. You want something that gives him a little bit more freedom to be a kid, right?
You did mention like cardiology team, hematology team. So, what are the different types of specialists he sees?
So in the very beginning, when you're in the hospital, is rheumatology is the huge one. They're the ones that come in and make the diagnosis and figure it out. And it's actually I wanted to mention this because it's kind of a crossover. Is that when he was in the hospital and he was getting all these treatments originally, and they weren't successful, they started to look at other things. They looked at maybe he has juvenile arthritis as a thing because he had the joint pain. So they were like, maybe this is not a Kawasaki disease. They did actually go to that. But when he finally responded and then his hand started to peel, which is also a hallmark of Kawasaki disease later on, when you're in the subacute phase, they're like, okay, no, I think we're good. It's Kawasaki disease. But so rheumatology in the hospital diagnosis is the major team, and then cardiology comes in after. So they're the ones you see. They'll come in the beginning, but you also see them for that 8-week, 6-week checkup. You really don't see rheumatology again unless you have some ongoing issues. But now, as a long-term patient, he is cardiology and hematology. Rheumatology is really not involved with us anymore because Kawasaki disease is self-limiting, they call it. It's an acute illness. It's not like a long-term illness. It's kind of you have it and then you get better from it. And then you hopefully go on and live a normal life. Or in Isaiah's case, you have these long-term um, effects, but you're no longer having Kawasaki disease. You just are living with the after effect of the disease. So no one actively has Kawasaki disease for their whole life. It's more the effects you're living with. So yeah, hematology manages his blood thinners, and then cardiology manages everything else in terms of his monitoring, his yearly testing, and they do manage and all his other heart meds.
No, that's so interesting. I had no idea that that was the case, and it's kind of like how you see it as the after effects. So that's interesting. I'm wondering if you know anything about this, but like, do you know specifically how this disease has impacted his social life? Like, is there anything that as a mom, like you had to do when he was in elementary school or like now high school? So like, how did the social aspect of living with this condition or the after effects of these symptoms, how did that come into play?
So in terms of socially, well, in terms of even just raising him, we always said we don't want this diagnosis to define who he is because it's not. And I think any kid that goes through things, I hope I hope they also feel that their diagnosis is not who they are. But like I said, because he doesn't know life before this, he just figured this is how things are. I mean, he takes medication. I guess he knows other kids don't take it, but he didn't really think of it that way. But we never really like to say, well, you can't do this because you had Kawasaki's. No, like we just steer him to other things. Like luckily, he didn't really want to play hockey. So we didn't have to have that conversation, right? We do other things, swimming, tennis, golf. I mean, even in elementary school, he still got to play basketball at that recreational level. Could he go on and play more competitive? Probably not. It'd be dangerous. It'd be a choice we'd have to make. And he played volleyball, again, the elementary level. But in terms of socially, it's not something we talk about or really focus on for him. And I think um, even with his friends, I don't think his friends really know, because he doesn't really talk about it. And like I said, I didn't really want to define him. He knows, and he grew up kind of knowing. I mean, and he's younger, is more the language a little bit different, right? Oh, your heart is special. You need to take these things. But obviously, as a teenager now, I think he understands more the gravity of what he's living with. Um, but yeah, in terms of social, like, we really treated him like any other kid, to be honest with you. I mean, there was only one or two things, like he couldn't go on the school ski trip. And that was a tough one because he was, grade 4. So you kind of understood that's the first time we kind of really had to say, you can't do this, and explain that. So that was hard as a parent. It's tough because you never want to say, you never want to take those opportunities away from your child. So that was hard. But otherwise, we try to not make make his health the focus of things. Because yeah, he has to go all these appointments every 3 months and he has to take medication, but that's just his life, like I said. So for us, it's kind of like, if we approach it that that's just part of your life and that's not the center of your life, then you're just living life like anybody else. You just have a few extra things you have to deal with. But I found that as he's become older, is different. He was the best patient. They love him at the hospital because he will take every blood test, not flinch. He'll lie there and not complain. And now it's a little bit different. I think, he doesn't want to miss school to go to the hospital, right? And he doesn't want to tell his friends, oh, I'm not going to be at school because I got to go to sick kids. Of course, he doesn't want to talk about that, right? So, and I get that and I respect that. And even for me, like, I run a blog about him that I wrote when he was younger to raise awareness. And now I've kind of stopped because I realize it's no longer my journey. It's his, well, it's always been his journey or our journey, but he's older and he has a voice. And I'm like, I can't, I have to respect that and kind of say, maybe it's time where if he wants to take it up and talk about it, he can. I can talk about it as my parent, but I gotta respect that he's almost an adult now and has to own his own journey. Um, so, socially, those are the kind of things that we didn't really want to affect him. I mean, in terms of practical, I'd still go into the school every year and talk to the teacher, talk to the principal. These
Yeah.
are things you need to know, right? These are things you need to look out for. If he tells you he has chest pain, you're calling 911. You're not going to just fluff him off and say you're fine. Like, they need to know those things. But that was a private conversation with me and the teacher, or me and the principal. It wasn't really, he wasn't involved in that.
Okay.
Yeah.
Yeah, that makes sense. And I think as you grow older, also, like, I think I relied on my parents when I was 13 a lot to do all these things, talk to the school about my condition because, like, I didn't really understand it. They were still trying to figure it out. So I didn't even know how to advocate for myself. So I was really relying on them, and I was really grateful for that because they were the ones that were able to get me the accommodations that I needed at that time. But now in university, it's different where I'm more involved in everything. Like, my parents are not involved at all. I do tell them about it if I have any issues with accommodations. I also live 5 hours away from them now, so it's more like I have to take care of my own condition. But like, you realize that over time, there's still in my healthcare. Like, my mom will come to my rheumatology appointments, different things like that. So it's not like they're completely out of it. I think it's shifted towards I'm the one that's going to be living with it forever. So how do I now take charge of my own health? And I found that very hard because I thought that it was my parents' job to do all of that. But in reality, they're there to support me but I'm gonna be living with it. So it's hard.
Yeah, absolutely. And I think that's the next thing for me, right? When we talk about worries, like in our journey, the worries keep changing because he's been through a lot of other things that I didn't even mention. But now the next thing is transition, like you just talked
Yeah.
about, because he's very responsible. But it's his nurse practitioner keeps kind of probing us that, he needs to start taking charge of these things. And so that even at appointments, I kind of let him talk, where it was always me talking. So now it's like you talk, like he knows his medications, like at least he's responsible with that and he knows when to take them and that kind of thing. But the next step is being able to advocate for himself, as you just said, to ask those questions if you don't understand something, and to just, voice those concerns that you have. And then, going to adult care is the part that's terrifying me right now, because it's different. Like his doctor always makes a joke that, when you go to adult care, there's no clowns walking the halls like it's sick kids. And I'm like, yes, I know. So he's like, they're not going to run after you. If you miss an appointment, they're not calling you to say, where are you? You have to make sure you're at those appointments. And if you miss it, that you're scheduling it again, because they'll just let you, like, you'll end up lost to care,
Yeah.
essentially, right? Which is a
Yeah.
huge thing in our population as well. Like I've seen that already happen. And so for me, that's a huge worry, because I'll still be there saying, hey, did you do this? Or maybe going like your parents are going. But at the end of the day, like you said, you're the one living with it. And it's the same for him, where he's going to be the one living. If I'm not around, if he's at school like you are, he has to make sure his meds are filled, right? And he has to make sure that he's going to those appointments or has a doctor on standby somewhere locally that he can go to if there's an emergency, right? So that's the next worry for me as a parent, is that transition.
My parents didn't even know there was something called transition, and neither did I. And I only really learned that through other things that I got engaged in, like research and just learning more through my podcast and other people's journeys and knowing that transition is a thing. I think the scary part for parents is like, can I be in the room and know what's happening for my child?
Parents though need to understand that too, that your kid is still a kid. Like just because they have health or have health issues and have to go, they're still teenagers and they're still getting into trouble. And so you kind of do need to give that space for them to get that message from the doctors privately, because you can't assume that, as much as you would love to think that they're not doing stuff they shouldn't be doing, they're kids and they probably are, or at least thinking about it. So you need to arm them with that information, right? It always goes back to knowing, right? To have that information. So they empower them with that, give them the chance to get that information in from the right people. There's the other thing, right? And that's what we're like, communication with their provider is important, because you don't want them just getting that information off the street, because they're not
Yeah.
going to know about your specific diagnosis. So yeah, I think that that's really important, that communication and finding ways to do it in a way that's comfortable for them, because it may not be comfortable with their parents in the room. Yeah.
I'm wondering if you've had any comments from people within your culture, had any sort of worries of what other people would think about your son now having this disease, or have you ever heard of anything from other parents where culture has sort of like taken a part in now navigating their disease just because other people may have opinions
Mhm.
coming from your culture?
Right. So fortunately for me, I haven't experienced that firsthand. Um, so we have a really supportive family. And I think what I would say more, if we're talking about in general, the disease itself is tough because of the name. So Kawasaki disease is named after the doctor Kawasaki, who is the one that recognized this constellation of symptoms and realized there's some other kind of syndrome going on here that we have never wrote about. So he's the one that kind of, it's named after him. And I think the problem with that is that a lot of people assume, oh, this is only in Asian children. Listen to the name, Kawasaki disease, right?
Yeah.
So, which is not true.
Mhm.
To be fair, it is much more common in children of Japanese descent and East Asian descent. But it always worries me that parents that who have children that aren't of those backgrounds will be like, or the doctors even, oh, it's not that. That's only in Asian children. Because I've heard stories where doctors have said that. So that's an issue, because you're going to misdiagnose some children because you think it's only in Asian children, which is not true. So the name in and of itself, I mean, it has a longer scientific name, but nobody uses that, right? Everyone uses Kawasaki disease. So is a problem because there's stigma in a different way, in kind of the reverse way.
Yeah.
Um, so that has been an issue. But I think in terms of my other issue, though, in terms of culture, is that I find because so I live near Toronto, like I said, and it's very multicultural. We have it's probably the most multicultural city in Canada, I would think, and we have a lot of people are new to the country. Sometimes English is not your first language, so I think that one of the things I'm trying to do is kind of do outreach in those communities because they're the parents, unfortunately, that I don't think will advocate as much for their child to get this diagnosis because they just can't. They don't have the tools. There's a communication barrier there a little bit, right? So I feel like if we can get that word out more to those parents, it will kind of empower them. I always go back to this idea of information empowering you. So I think that's more my concern when it comes to ethnicity in this whole realm of the Kawasaki disease world, is that helping those parents, those families, kind of get a diagnosis sooner because I think they a lot of it's communication to explain the symptoms, explain what's going on, and to ask those questions. It's hard to do. It's easy for me to advocate because I'm speaking to a doctor that's speaking the same language that I know, right? And if it's not your first language, it's hard to say those things, and you're probably more shy to advocate and like stand up for yourself. So because you don't feel as confident in the language that you're in. So I think for me, that's more where this ethnicity idea of ethnicity comes.
Yeah.
But
That's
in terms of
interesting.
Isaiah living with it, I haven't noticed in terms of culture being feeling that stigma
Mhm.
um, personally.
For us at least, and like other guests I've talked to, like South Asian descent, like it's always like the daughter that has to like do the cooking and all those things. And some other like South Asian women that I've interviewed in my podcast living with like rheumatoid arthritis mentioned they can't cook all the time. And so it's hard to explain that because their mother-in-law will like expect them to do that, but they're in pain, they have fatigue. So in that sense, like there's already something that there's like these expectations that as the daughter-in-law, you need to be cooking and doing all these things and taking care of someone else, but they can't even take care of themselves. It may not be for every single family of that culture, but some women have actually mentioned that to me that it's been kind of challenging for them because it's hard for you to understand your disease and now explaining it to everyone else who's now in your family. They
Mhm.
might interpret it a different way. They might take it a different way, and they may not understand that you can't do everything the same way. So how do you kind of approach that situation? I think as you grow up, you meet new people, so then trying to explain it to them and you'll find new ways. And I think for me, like I didn't start advocating all of a sudden when I was diagnosed. I think when I was 18, I was like, okay, I think I can do something and start talking about it and helping myself. But I don't think before that I was ready to, like, I needed my parents' support all the time, and I still do. But it's just that now I can talk about it. Before I was like, I don't want people to think that this is who I am. Like I have problems all the time. I can't do gym class. I'm lazy. Like all these different comments. But now this is sort of my life and I'll like learn and adapt to it. And I think probably for Isaiah that will be like the same thing where he will learn how to like adapt his life to it. And he's lived with it all of his life. So this is his life. So it's a little different in the sense that I'm learning how to like adapt my day-to-day activities, but this is his life.
Yeah, but I think there's always going to be things he's going to have to adapt, right? Like
For sure.
yeah, like in terms of like still stay physically active. I mean, it was kind of the opposite. We're always kind of hounding him about that, like making sure you get enough exercise and that kind of thing. So it's kind of motivating himself to keep up with that when we're not there to nag him to do those things, right? And about eating healthy and those kind of things. So yeah, it's a lot of that. But you touched on an interesting point earlier when you talked about family having to explain it, and not everyone's going to understand it the way you understand it. And I completely get that from your standpoint, especially because when you talk about pain, right? People pain is a range, right? So people may not, they'll be like, oh, it's probably just like this. Why can't she still be doing those things, right? Like people don't understand, and I don't because I'm not dealing with your diagnosis either, but I'm sure there's a range and there's a point where it's just debilitating where you can't do those things. And people people just don't can't wrap their head around that because they haven't lived in your shoes, right? And it's the same with Isaiah. People, as much as I try to explain it, people sometimes don't get it either. Because so Isaiah had a double bypass when he was 4, because he had a blockage in one of his aneurysms. So, he had that, and then more recently he had a stent put in, because again, another blockage. But people are always like, "Oh, well, he's fine now, right?" Like they're like, after the bypass, he's fine. And I'm like, not really, because he has other aneurysms, right? So he's still on the blood and he's doing something. But I guess it comes from a good place. So I'm not upset about it, but it's just hard because you can try to explain it, but maybe it's just too complex for people to absorb all of it or remember it. So they just like listen to you, but maybe don't really take note of the intricacies of it. So they're like, "Oh, he's fine." I'm like, so now I'm kind of like, "Yeah, he's fine," because he's stable. If he's stable and there's nothing imminent, no major changes, yes, he's fine. He's still on his medication and he's fine. And I mean, that has been the case. So I kind of just go with that. But I completely resonated with me when you said that about people having to explain it and people not understanding, because I get that all the time as well. But I guess I have to understand not everybody needs to know every single thing about his
Yeah.
diagnosis, right? They just need to know, is he okay? Is he not okay? And yeah. So
That's recently what I've learned too, because I think in high school it was so obvious that I had to like go to another room to write a test because I needed a scribe or different things like that. And so everyone noticed that there was something wrong with me because why am I not writing with everyone else? Why am I not handwriting? And I'm just sitting there in class and someone will give me my notes later. So then I was like, oh yeah, like I have arthritis. But then in university, I realized not everyone needs to know I have arthritis. Yes, if they come across my podcast, that's a different situation.
yeah,
But not everyone, I don't need to tell every single person that I meet I have arthritis. It's so invisible that no one can actually tell unless I'm like, I have arthritis, I'm on these medications, I can't do this certain activity. If someone asks me to go skating, I'll be like, no, because it digs into my feet and my feet are like in pain. I can't do that. Then I have to be like, yeah, I have arthritis. Like, this is why I can't do it. I mean, I never liked skating anyways, but just like different things like that where
yeah.
it's just now I don't tell every single person that I meet unless I really need to. And you realize that over time because then everyone has their questions and their comments and it's just like not needed anymore.
Yeah, no, I absolutely get that. And I feel Isaiah is probably exactly the same way. Because why? Like you said, it's invisible. Nobody needs to know that. And even when he goes for appointments, he doesn't need to say, "Oh, I have a doctor's appointment." That's all you need to say. You don't need to say, "Oh, I'm going for an MRI," or
Yeah.
it's not necessary. And I respect that, and I think that you need to whatever you're comfortable with. Maybe your close friends, you'll tell them, but other people, they don't really need to know. And if you don't want to know, then it's okay. Because like you said, it kind of opens up judgment too, right? Like I'm sure for you, you were like arthritis. They're like, "Isn't that old people? Like, what do you have
Yeah.
arthritis?" Like, I'm sure you get that
Oh,
because
yeah.
that's what people's brain instantly goes to. The same thing because Isaiah is what we call acquired heart disease. So, but people are like, "Oh, heart disease. That's like when you have eat too much fatty food and you have cholesterol, high cholesterol. That's old people." But no, the acquired heart disease is any heart, like pediatric heart disease. So people that have congenital heart disease, you also refer to it as heart disease, even though they were born with it. So it's yeah, people that aren't educated, which you can't fault them for, but will have their idea right away when they hear the word, right?
Yeah.
And understand it. Yeah.
I think also like at one point we weren't educated either. So I feel like it's not like we would be in that case too where we would think, oh, only old people get arthritis. So I think we're just on that mission to change the
Yeah.
stigmas that are there. And so I wanted to move on to your initiatives and interests. And as we kind of mentioned, you are one founding member of the Kawasaki Disease Canada. What was the inspiration behind this organization? I kind of know like your son's journey now, but how did this come to life?
So it's actually a funny story. So January 26th is International Kawasaki Disease Awareness Day. I think that was started by the US, the KD Foundation in the US, but I used to follow them on social media. And then it was 20, I think it was 2013. It was 2014. 2014. So I was on Twitter and I tweeted something, and then I would search like Kawasaki disease and see what other tweets were coming up for that day. And I saw one from this lady who was Canadian, and she was like, "Oh, starting a Kawasaki disease Foundation Canada, so excited. And I was like, oh my gosh, the same thing I was wanting to do. So I messaged her, and then she messaged me back, and it ended up, so her name is Elizabeth Heald, and she's one of the other co-founders. Um, and we kind of just took off from there. So in 2014, she already had a board assembled and had already started the process. So she was miles ahead of me, but it was just a great partnership. And there was other people on the board that are also founding members. So that's kind of how the internet brought us together. But so Elizabeth's story I should share because it's a different story than ours. So her son Dylan died at the age of 6. He had a heart attack due to undiagnosed Kawasaki disease. So he likely had Kawasaki disease when he was younger, but it never got diagnosed. So he was living with these aneurysms, like Isaiah, but not with blood thinners. So when he was 6 years old, he passed away from a fatal heart attack. And it wasn't till the autopsy that they came back and said he had died from Kawasaki disease. And for Elizabeth, that was the first time she had also heard those words, Kawasaki disease. So that was her inspiration why she wanted to start a charity in Canada to focus on awareness and research and support. So it was really fortunate for me to meet her online because then we could work together instead of working separately to kind of achieve those things. So for me, it was obviously Isaiah is my inspiration. I was like, if I can say, and that's why I started my blog too, right? It's like if I can save one child, even one, from what he has to deal with every day, then I will be happy. I will have done something good for someone else and done something in his honor, right? And some good can come out of this. So that's kind of the inspiration behind what we do. So awareness is our main thing. And our mission is to make Kawasaki disease top of mind for all Canadians. So we want everyone to know about it. You may never need to use information, but if every parent, every doctor, every nurse, every grandparent, every caregiver, every daycare worker knows about this, then hopefully these kids will get diagnosed sooner and we'll have less children living through what Isaiah living through. So that's our main thing is awareness, but we also support research and we also do support, which is my main focus, right?
Yeah. No, that makes sense. Wow. That's really hard to kind of live with knowing that because you didn't know that knowledge, something like that could happen to your children. And so I think what you both are doing is honestly amazing because I think the more people that are aware, like you mentioned, it'll make such a big difference in lots of children's lives and also families' lives so they can kind of stop any sort of progression as soon as possible. And so I'm wondering, like, what changes have you seen in recognition to Kawasaki disease over time being in this organization? Like, is there something that you've seen change from when you've started it to now?
It's hard to know. We're right now looking at the numbers, waiting because I know a lot of the research is done through Sick Kids Hospital, and they are currently running numbers for the latest Canadian numbers in terms of incidents, but we probably won't have that till later this year. But I think so that I can't speak to necessarily. I do think that there has been heightened awareness because during COVID, um, I don't know if you saw on the news, but they talked about a thing called MIS-C,
Yeah, I know that.
multi-system inflammatory syndrome in temporarily associated with COVID. So basically, is very much like Kawasaki disease. So they were talking about these things concurrently. They were like a Kawasaki disease, like infection has been showing up in children. So it was in the news for maybe a month, and it ends up being there's debate right now if MIS-C is Kawasaki disease and just in the range of Kawasaki disease, or if it's a completely different syndrome. But the symptoms are very similar. Treatment is the same. So the only silver lining, I guess, we can take from that was that it was being talked about a lot on the news. So hopefully a lot of parents have, looked it up or paid attention. So at least, it got a little bit of exposure there. And that maybe doctors also have it more top of mind because now they're like, oh, it's MIS-C because COVID is still out there, right? So but if it's not MIS-C, oh, maybe it's Kawasaki disease. So we're hoping that there's some awareness through that. But I mean, anecdotally, we've had families come to us. Like recently, I had a family message us to say, her daughter couldn't get a diagnosis and she was Googling it and she came across one of the stories we posted. So one of the things we do on our website is post stories from families, from different patients that were willing to share their story. And she happened to hit his story and she read it. She said, "This is exactly what my daughter has." She went back to the doctor and said, "I read this online and I think this is what she has." And they were like, "Oh, wait, you're right. It could be." And so she ended up getting the treatment she needed. Unfortunately, she still had developed long-term consequences, but at least she got the diagnosis because if she had never gotten it, I mean, could she have ended up like Dylan? I don't know. So those kind of stories, at least we know we're making a difference. In these anecdotal stories I get, I don't have numbers, but I'd like to hope that the more information we have going out there, that people are receiving it and sharing it, and that we are doing our part to raise awareness of Kawasaki disease.
I'd like to end off the podcast episode with an advice segment. So, what advice would you give to parents of newly diagnosed patients?
Okay, so there's so many things I would like to say about that, but I think if we're talking about diagnosis, I would say don't be afraid to ask questions. Advocate, advocate, advocate. I know it's hard because some doctors will kind of like, no, it's not that. Because, Kawasaki is also more common in boys. Oh, she's a girl. She didn't have that. She's not Asian. She didn't have that. No, I think you as a parent know your child. And if you think something is wrong, you keep asking questions until you get an answer to your question. So I think that's huge in terms of diagnosis, getting there. The problem is, as you're advocating, I'm saying this to people that don't know their child's Kawasaki disease. So I guess once you get the diagnosis, then it's continue to advocate. Make sure they're treating them as soon as they can, because we want the inflation down. So don't be afraid to bug the nurse. Just ask, what's the status of this? And as you're going through that, ask questions. What is it that I'm receiving, and what are the side effects? What are the things that we need to look out for? Make sure. And then when you're discharged, make sure you're armed with information, because there's things like still monitoring for fever. Well, what does that mean? Like, when do I come back? Do I need to call you if this happens? How do I know? So knowing all those things, I think, is really important. And I think the other thing is in terms of, but for us, for families like us, what I would say is, take it one day at a time. When you get this kind of diagnosis that is life changing, because more often than not, some kids' aneurysms are able to go back to normal depending on their size. In Isaiah's case, his were giant, and the chance of that going back to regular size is very slim. But I think it's take it one day at a time. You can't look into the future and say, well, is he going to have a heart attack? Is he going to need bypass? Is he going to do? You can't. It's hard. Trust me, I know it's hard, but you kind of have to just take it a day at a time and kind of deal with life as it is now, and then kind of try not to worry about those things. When it comes, it will come, and you will figure out a way to live with it and deal with it. Like when Isaiah had his bypass, we found out on the Thursday, and no, Friday maybe, and he had it on the Tuesday, like literally a few days later. That was the hardest day of my life. Like, he was in there for 10 hours, and I never want to relive that day. That was the scariest day of my life, but you find a way to get through it. Like, I never anticipated that, but it came, and we lived it, and we were okay. And we didn't get necessarily the outcome we wanted, but again, you just keep on going, right? Um, and then I think but don't lose hope. That's the other thing. Hope is a huge thing. My cardiologist said to me, in the face of uncertainty, there is always hope. And that's the other thing. Don't lose hope that your child can't have a normal life. Of course, they can still have a normal life. And then the hope that there's new medical advances, which is my biggest hope, that one day there'll be something that can maybe regenerate some of Isaiah's heart muscle, right? Because those things are happening. And it's amazing what science is doing. So I think parents need to hold on to that too, right? The hope that it's not always going to be like this. There could be better things, more advances that make your child's life better than it is today, despite what they've been through. So I think, and then lastly, I would say you're not alone. Find the support you need, which is something I mentioned earlier. Don't be afraid don't think you have to go through this alone. There are people there. It might be hard to find them, but if you have Kawasaki disease, you know where to find me, katiecanada.org, and we will do whatever we can to help you. But I think those are the main things that I would say to parents.
Thank you so much, Karen, for coming on this week's podcast episode to share your perspective as a parent of a child with Kawasaki disease. We started off discussing what Kawasaki disease is and how it kind of manifests, and the symptoms appeared with Isaiah. You talked about the challenges Isaiah faced and also you faced during the diagnosis process, and then how advocacy came to light as an important factor in pushing for a diagnosis. You talked a little bit about the social and cultural aspects and stigmas that may be out there about Kawasaki disease. And then we talked a little bit about the double bypass surgery, and as well as Isaiah's medication journey. We kind of talked about communication and how important that is when it comes to living with the condition, whether that be communicating in the school setting, healthcare setting, and more. At the end, your role with Kawasaki Disease Canada and your role within this organization and what it's all about. So I will definitely link your social media down below, as well as any links to Kawasaki Disease Canada. Everyone make sure to like, comment, subscribe, and I'll see everyone in 2 weeks on Take a Pain Check. Thank you so much, Karen. Bye.
Thanks so much for having me. Bye.